To some new research that's shown the growing concern around the costs for healthcare in Australia. I'm joined by RedBridge Director Samaras. You've been talking about this morning. You've done some analysis on this. Where are things at? We know you and I have spoken many times about the pressures broadly on costs for people, but healthcare is looming as a big one. Talk us through the latest that you've got.
Absolutely. I mean, the cost of living crisis is actually connected to healthcare for a lot of Australians, particularly if you're living in the outer suburbs and the regions. And so surveying Australians over the last few months, the one thing that we do know, only about 40% of them have confidence that the public health system can actually take care of some of their basic needs. About 48% think they can actually use it for elective surgery. And flip side, those who have got private health insurance have a lot more confidence. So 72%, for example, of all those that we surveyed with private health insurance think they can actually access elective surgery in a timely manner. So there's a collapse in trust and reliability of the public health system.
Of the public system. On the private side, there's more confidence, but more costs as well. What's the situation on that front?
It's going through a bit of a transformation at the moment. So what we're seeing is huge uptake of private health insurance amongst Indian and Chinese Australians. So these are two emerging significant electoral diasporas that shaped the 2022 election. So seats like Bennelong, Reid, the by-election in Aston. These communities are very, very important. Parramatta, and so they when they arrive in this country, they are required to take out private health insurance. But once they become citizens, they continue on with that membership. And we know that even when it's not compulsory, like for their children becoming adults, leaving home, they too are taking it up. And so when speaking to them, for them it's choice, it's seeing the doctor that you want to see, it's agency, there's a whole number of positive attributes which they list. And they are definitely a very huge subscribers of private health insurance in this country now.
And where would you say the health cost issue is politically ahead of the next election? How much does it loom as a feature of what we're going to see? Because traditionally, Labor has seen health as one of their equities, one of their brand strengths.
Yeah, absolutely. It's going to be in the outer suburbs. It's definitely going to be in regional Australia. And in regional Australia in particular, we are looking at a situation where people have lost complete faith in the public health system. They are reporting astronomical numbers to us of cases where basically they just don't go and see a medical specialist even when they're sick, mainly because they can't afford it, because they're obviously accessing bulk billing is very hard these days. And so that Medicare campaign that was run in 2016, that Medicare was the safety net of the country. Most Australians viewed Medicare as a public health safety net. That's now been replaced by private health insurance. So when we ask Australians, well, what do you now consider as the health safety net? They say their own private health insurance rather than actually Medicare or the public health system.
Well, that's quite the mindset shift, isn't it? Samaras, thank you for your analysis. Very interesting numbers and insights.